Hello, today I will be discussing the value of liver biopsy in anorexia nervosa-related transaminitis through a case study and a literature review. Anorexia nervosa is a psychiatric eating disorder defined by a significantly low body mass index associated with the fear of weight gain and a lack of insight regarding body shape. This condition results in multi-organ complications, including an elevation of liver transaminases. Suggested mechanisms of liver injury include autophagy, oxidative stress, and ischemia. This occurs in approximately 60% of cases, especially males and those with pure restrictive anorexia nervosa. An example was a 19-year-old female who presented to our hospital with a BMI of 12.7 kilograms per meter squared and AST and ALT levels greater than 40 times the upper limit of normal. Due to persistently elevated transaminases, a liver biopsy was performed. Her liver biopsy showed near normal histology, except for mild hepatocyte atrophy. In the upper two images, we see no portal or lobular inflammation. The lower two images show Kupffer cell hyperplasia and increased iron deposition. This prompted us to explore whether this disconnect between clinical and histologic evaluation was typical of AN-related transaminitis. We conducted a review of case reports and series of AN patients who underwent a liver biopsy or autopsy for suspected liver pathology to examine the spectrum of histopathologic findings in these cases and its relationship to clinical factors. Searches were run on Google Scholar using the search words shown. English language articles were selected if they featured a case with a patient 18 years or older admitted with anorexia nervosa who develops transaminitis during their hospital stay and undergoes either a liver biopsy or an autopsy. 22 articles met these criteria after full-text review, and a total of 36 cases, including ours, were analyzed. All but 4 patients were female, and the median BMI was 12.4 kilograms per meter squared. Common presentations included severe malnutrition and hypoglycemic coma. Greater than half of the patients had significantly elevated transaminases, more than 15 times the upper limit of normal. Many patients also had impairment of their liver function tests, and some patients tested positive for other causes of transaminitis. Glycogen depletion and Kupffer cell hyperplasia were among the common findings on biopsy. All but one case had intact liver architecture, and while some cases showed necroinflammation and fibrosis, only half of them had significantly elevated transaminases. Also, despite being in a nutrient-deficient state, 2 cases showed increased glycogen storage, and there were 2 cases of non-alcoholic steatohepatitis. And here are some examples of these findings. Starting in the upper left corner and going clockwise, we see steatohepatitis, glycogenic hepatopathy, fibrosis, and necroinflammation. AN patients show a wide spectrum of liver histopathology, which doesn't always correlate with the degree of transaminitis. A biopsy is therefore warranted in these patients. Thank you.